Coming up on 6:53, can the 11 million Americans with coronary heart disease live longer and healthier lives despite their illness?
Well, the answer is yes. Our resident internist, Dr. Larry Goldberg, explains. Good morning, Doc.
Good morning.
Good morning.
The new American Heart Guidelines will help conquer the nation's #1 killer and allow many heart disease patients to live longer, healthier lives. The American Heart Association estimates that $30 billion will be spent this year on angioplasty, bypass surgery, and treating heart attacks. But research shows as few as 1 in 3 of those heart disease patients actually benefits from a dual approach of lifestyle changes and medicines which could cut the risk of another heart attack or death. Why? Patients may not be counseled about the changes, may not follow them, or insurance may not cover the expenses. So the American Heart Association is promoting definitive new guidelines, which are also endorsed by the American College of Cardiology, that can reduce recurrent heart attacks and deaths by about 30% and save billions of dollars. The guidelines bring together what physicians know about lifestyle modification with new developments in drug therapy. That includes prescribing cholesterol-lowering medications, aspirin to prevent blood clots, ACE inhibitors and beta blocker drugs after a heart attack to improve survival, and estrogen for postmenopausal women to reduce the risk of heart attack. The American Heart Association emphasized patient compliance with medication and stresses the importance of quitting smoking, eating a healthy diet, watching cholesterol, weight and blood pressure, and engaging in regular physical activity. Patients are most receptive to making these changes when they're in the hospital. Consistent follow-up can keep them on the track to a longer and healthier life.
How big a part does smoking play in coronary disease?
Smoking plays a big part. You're going to really increase your chances of getting into problems with heart disease, and men are especially prone. There's a number of things that you can do to actually help reduce your risk of heart attack and make a substantial impact. And as we just mentioned, 1 in 3 out of patients out there, out of 750,000 patients that are afflicted with heart disease, do not take advantage of the lifestyle modification. And those include stopping smoking, using the American Heart, which is called a Step 2 diet, and that diet is actually available through the American Heart Association, managing your blood fats, which is keeping your LDL cholesterol less than 100, physical activity was up to 30 minutes a day, and that's just, we were talking a little bit about that earlier in the broadcast.
Just walking will do it.
Just walking, and it's just 30 minutes a day. It can be relatively non-aerobic. The point is you're getting out there and doing it. Weight management, staying within 20% of your ideal weight, antiplatelet therapy with the aspirin, or if you can't tolerate aspirin, there's a blood thinner called warfarin or Coumadin, ACE inhibitors and beta blockers for post-heart attack, and estrogen for postmenopausal women.
So a lot you can do.
We're talking about mainly men, but women also. This is the #1 killer of men, right?
Actually, it's the #1 killer of men, the #1 in Bexar County, and women are actually relatively protected with the estrogen. So it's really not a problem, and that's where it really is a man's disease until you get into the post-menopausal phase.
Oh,
okay.
I see. I didn't realize that hormones had that big of a part to play.
Absolutely. It's hugely protective, and you're